Okay. Dr. Abu-Ras, we were talking about the protocol earlier and the different criteria regarding patient selection. I would like you to look again at what we marked as Exhibit 3, which is the July 9th, 1999 report.
Okay.
I think you mentioned that according to the protocol, the upper age limit was 65 years. Is that right?
Yes.
What page you on?
The protocol, I guess page 3 of Appendix B is what the witness testified earlier. The upper age level was 65 years. The lower level was 19 for boys and 17 for girls. Do you remember that testimony?
That's what it says.
Okay. And I think you were telling me that any clinical trial, certain factors are determined before the start of the trial for whatever reason, and those are important to follow. Is that right?
Correct. As long as, yeah.
Okay. Did I stop you from
Correct.
saying something? Or
Correct.
Okay. Would you look at the report that is dated July 9th, 1999, which was Exhibit 3 that we marked?
Mm-hmm.
Okay. Can you just page through there and tell me how many patients you find were over the age of 65? And you know what, make it easier? Just tell me, can you just say patient 1,
4.
patient 2? Okay.
4
Okay.
in the July.
4 in the July. Well, that would probably be the same
Same,
as
right.
the January, correct?
Mm-hmm.
Okay. Did you have any discussions with anybody why these people were included?
I never seen this
Okay.
before.
So you never heard anything about
Absolutely.
including people who were beyond the age limit?
No.
You had no reason to know?
I didn't, first time I see that.
Okay. I would like you to look at patient number 2. Same report.
Mm-hmm.
I think you testified earlier that one of the failures that you had in your private practice was because an implant was placed in the sinus.
Correct.
And if you look at patient number 2, he's a male, age 26. Can you tell whether, well, first of all, let me ask you, do you know whether the placement of this immediate load implant in a sinus is not permitted by the protocol?
Objection, vague and ambiguous.
Do you know? Is it?
Repeat it.
Have you looked at you've looked at the protocol, obviously.
Right.
Okay. Do you know whether or not it's appropriate under the protocol to immediately load the Sargon implant in the sinus?
It's not.
Okay.
It's not. It's not. It's not the protocol. No.
Okay. And the reason for that is what? Remember, I'm not
Right.
a dentist, so
Okay.
it seems very elementary.
It's
to
basically the sinus is a space. You have no bone,
Okay.
and you need time for bone to heal and accumulate so you could load it.
Is there anything that you can see in this report why the Sargon implant would have been inserted in this patient in the sinus?
Objection, no foundation.
The only thing strange for me is the word osteotome here.
Okay, and why is that strange?
It's not. First time I seen it here. First time I see this.
Okay.
Again, it's not part of the protocol.
Okay. Is osteotoming something
I
that
don't-
you're aware of? Do you know what that is?
Yeah, it's compaction of the bone.
Okay. And how does a surgeon compact the bone in osteotomy?
With a special gadget, special compactors.
Okay. Well, but how does it operate? Is it just
I really don't know much about it.
you don't?
No, but this is not, I haven't seen this before, so I don't know.
Okay. Now, if you look at patient number 2, it says that a 13 millimeter implant was placed in healed site number 12, and the implant was loaded immediately. And then, you see that?
Yeah.
Okay, and then the next paragraph says osteotome used to elevate sinus by, I think, 1 millimeter. Okay, you mentioned earlier that the Sargon implant is not an implant that should be loaded in a sinus. Is any implant to be loaded in a sinus? Can you load any implant in a sinus?
Objection. There's no foundation for your question.
Go ahead.
2 issues now.
Okay.
No, okay. If naturally, usually, if you want to put implants in the sinus and there's no bone, you have to create the bone.
Okay.
There's a procedure called sinus lift, or they put grafts.
Okay.
Okay? That's
Okay.
what the acceptable format.
Okay.
And then once you have the base of the floor, then you put the implant in it.
That's any kind of normal
That's
implant.
that's it.
Okay.
And then
What is the difference between the
Oh, I'm
immediate
sorry.
load? I'm sorry. I'm sorry. I didn't mean to cut you
okay,
off.
and so here you're talking about the 12 was unloaded and then re-expanded. This is the procedure. This is the right procedure. Re-expanding, but it should not be loaded.
Okay. So,
So that's again not protocol, not the Sargon protocol.
okay. So, and I think you said that osteotoming is also not called for by the protocol.
No, it's not part of the Sargon system.
Okay. Now I'd like you to look at, go to the patient number 14.
Yeah.
This one says that a 13 millimeter implant was placed in site number 4 in an extraction socket and loaded immediately.
Mm-hmm.
Do you know whether that is, and then also below that it says similar to the other one we just looked at, that osteotome was used for sinus elevation. You see that?
Yes.
Okay. Does this indicate that the Sargon implant was loaded immediately in the sinus?
It says that, yeah.
Okay. And again, this was not part of the protocol for the Sargon implant.
Correct.
Okay. Do you have any idea why this was being done?
I do not know.
Okay. I'd like you to look at patient number 11. This is a female, age 44. It looks like she had quite a few implants. Five 13 millimeter implants were loaded immediately and loaded 4 months post-placement due to poor bone quality. Do you see that?
Yeah.
My question is would the poor bone quality be known prior to the time the patient was selected for the study from some kind of x-ray or something else?
That's what I'm telling you. There's a lot of incomplete information here. First of all,
No, that question, doctor, was,
No.
would it be known?
would it be known? Yes.
Okay.
Yes.
So you would be able to
from
tell.
the X-rays before and during the procedure.
Okay.
Both.
So tell me again, as a layperson.
As a layperson, if we base again, the protocol said you should have X-rays, you have CT scans, and all of that. Okay. And so that should tell you the bone thickness and also the bone density. All right. Also, with the Sargon system, is when you go in and place the implant, you know when you expand it whether you have mush or you have solid rock.
And you know that right away.
Immediately. Yeah.
Okay.
So here I have to say that base implants were not loaded because maybe, again, it says there's poor quality based on the, and loaded 4 months post-placement. You know, that's very late.
Okay.
Patient is in provisional restoration. But the patient's still now not in final restoration, almost 2 years later.
Okay. And does that cause you some concern?
We discussed that earlier.
Okay.
Same issue.
Okay. Tell me what you mean by it was very late, loaded 4 months post-placement. What does that mean? Very late.
We're not loaded immediately and loaded 4 months post-placement. This is not protocol.
Okay.
Again, not protocol, not a Sargon system.
Okay.
Sargon system says you basically have to go, you have to do something about it.
You immediately load it.
You exactly. In the 3rd week, if you let it rest for weeks, not for 4 months.
Okay. And so
That means you'll never know in 4 months what's going on, usually.
you won't know.
No, I mean, you can't let it go for 4 months. This is not the system. This is not the Sargon system to put an implant and watch it for 4 months.
And then so.
It's not called, okay? In other words, I personally have to exclude this case from the study
Okay.
because this case is not a Sargon system.
Okay. And I think that's what I was trying to get
Yeah.
at in going through
Yes.
some of these examples. If somebody is 70 at the time of placement and it clearly doesn't comply with the upper age limit, does that affect the
whole
study?
idea of research is that you do exactly, you take the Sargon implant,
Yes.
you follow the Sargon methodology,
Yes.
you follow the Sargon criteria, and then say it works or it doesn't. But if you're going to come in and change this and change that and change this and change that, we're no longer doing a study.
Okay.
Okay, that's my feelings about
Okay.
it.
From a scientific standpoint.
Correct.
The entire
Correct.
integrity of the study.
I would personally delete this from the case.
Okay.
I would delete the patient who's 67 years old. I will delete the patient who's 70 years old,
Okay.
69 years old. Although not much difference after 4, but again, if you need somebody to be a critical analysis of the results, they'll shoot you down. You're dead.
Okay. Thank you.